So, navigated focal laser of macular teleangiectasia type 1. Firstly described by Gas and Bloody in 1993, idiopathic macular teleangiectasia or aneurysmal teleangiectasia is considered a variant of Coats disease. It affects male adults and consists in unilateral dilated and aneurysmal capillaries with associated ischemia and exudation, typically limited to the central macular region. Focal laser photocoagulation remains the standard of the treatment. The aim of our study is to evaluate the anatomical and functional outcome of selective photocoagulation of idiopathic macular teleangiectasia type 1 by navigated focal laser. Patients suffering of idiopathic macular teleangiectasia were included in this retrospective analysis. All patients underwent a complete ophthalmic examination and were treated by navigated focal laser. Best corrected visual acuity and OCT were evaluated at 3 and 6 months follow-up after laser treatment. Laser photocoagulation was performed using nevertheless by one experienced clinician. Careful superposition of ICG and/or SDOCT images was performed. Spots were selectively planned on microaneurysm and/or capillary teleangiectasia seen on ICG and/or SDOCT. SDOCT were used to analyze the efficacy of the treatment at 3 and 6 months. We included and treated 7 eyes of 7 patients or male. Mean laser power was 106 with pulse duration mean at 132. We used ICG on 6 on 7 eyes and SDOCT in just one case. So we treated 7 eyes of 7 patients. 3 months after navigated focal laser photocoagulation, SDOCT analysis showed the occlusion of aneurysmal dilation in 100% of cases, with a significant increase of best corrected visual acuity at 3 and 6 months, a reduction of central macular thickness and at 3 and 6 months. Here, one case of a 53-year-old man presented with a progressive loss of vision in his left eye. Best corrected visual acuity was 20/80 at presentation. Multicolor imaging showing the presence of macular edema and hard exudates. Fluorescein angiography revealed the presence of a juxtafoveal macular teleangiectasia in early frames with cystoid macular edema in late phases, and SDOCT at baseline passing through the fovea, showing cystoid macular edema. Focal laser treatment. The patient was treated by selective navigated focal photocoagulation. The following parameters were used. We used non-contact lens. A total of 33 delivered spots with 90 milliwatt on average, 124 milliseconds, and 100 micron by overlapping ICG on the color fundus photo taken with the Navilas system. Treatment duration was 6 minutes, including time required for the pre-planning. The patient did not experience any pain during the session. At 3 months follow-up, the patient reported an improvement of best corrected visual acuity to 20/32. Multicolor imaging showing the progressive resolution of macular edema and hard exudate. SDOCT showed the regression of macular edema with significant diminution of central macular thickness. No scar in the macular region was found after that session. At 6 months follow-up, the visual acuity improved to 20/25. In our series, navigated focal laser treatment was found to be effective and safe for the treatment of idiopathic macular telangiectasia type 1 with resolution of secondary edema and macular exudation without any side effects in all treated cases. Evidence based on cases published in literature indicates that laser photocoagulation remains the gold standard for macular edema secondary to idiopathic macular telangiectasia. Since Navilas offers precise laser delivery, it proves more advantageous for treating idiopathic macular telangiectasia located very close to the fovea. Thanks to the eye tracking and multimodal imaging overlapping, we treated effectively and safely all the patients, including those who were very close to the foveal center. Limitations include the retrospective nature of the study, small sample size, lack of control group, and short follow-up. Idiopathic macular telangiectasia are ideal candidates for navigated focal laser treatment. Thanks to the eye tracking and the superposition of multimodal imaging on the Navilas system, it was possible to effectively and safely treat all type 1 idiopathic macular telangiectasia, including those very close to the foveal center. Other prospective randomized studies with a larger sample size and longer follow-up are necessary to confirm our results. Thank you for your attention.